Hey, I'm Dr. Seuss from Clackamas Smiles. We get a lot of questions about dental bridges, like what is a bridge? When are they used? Do I need one? I've heard of someone who had a bridge. I'm here to answer some questions about bridges and bust any myths and then kind of give you guys a little peek about what bridges are like. A dental bridge is a replacement for a missing tooth. If you have an open space where you had a tooth or you'd like a tooth and there's a tooth on the front side of that and a tooth on the back side of it, a bridge sits on those two anchors and it replaces the missing tooth in the center. So, for example, you're missing one of your front teeth and you had a bridge on the tooth in front and the tooth behind. It gets installed, and then when you smile, the outside world, all they see is natural teeth and they don't see an open space anymore. So when I get the question, what's the difference between a bridge and dentures? There's one big difference, and that's a bridge stays in and dentures are removable. If we replace a tooth with something that comes in and out, whether it's a denture or it looks like a kid's retainer, that's something that you have to clean. It's something that you have to store. It's something that you might lose, you might chip, or you might break it. A bridge is different than that. A bridge actually gets glued in place. So you don't take a bridge in and out. Once it's installed, it stays in there and it feels really natural, just like a part of you. When people are deciding, hey, do I get a bridge? What's the good part? What's the bad part? The nice part about a bridge is it's set. You can't lose it. You can't forget it. It's glued in place. Now, when you have something removable, it's always coming in or coming out, and you might lose something like that. When we're making a bridge, we have some decisions in terms of what do we make that bridge out of. So it could be as simple as, metal structure and then it has porcelain on the front of it. And that's considered a little more old fashioned. And there's newer bridges that are all white color. They don't have any metal in them. So you get to decide a little bit in terms of what you'd like the bridge made out of. And that can impact how it looks and a little bit how it fits around those teeth. When patients ask us, hey, do I need a bridge? Am I a good candidate for a bridge? The answer really is you have some alternatives. And there's 4 big choices. Number 1 is you don't replace a missing tooth. You can walk around looking like a jack-o'-lantern. If you're fine with the open space, keep your open space. Option 2 is something removable. It could come in or come out. Picture a kid's retainer with a false tooth attached to it. When you pop it in and you smile, it looks like something's there, but you'll know there's something artificial. You got to take it out at night, store it in a glass of water. You got to clean it. And then those things are frequently lost or chipped or broken. That's just not really the most popular solution. The third option is the bridge itself. We like bridges because they're glued into the teeth. They stay in place. You can't lose them. You can't forget them. But there's some drawbacks. And that drawback is the bridge needs to sit on the tooth in front and it needs to sit on the tooth behind. And in order to do that, we have to do some drilling or grinding on those teeth. A lot of people don't like that idea. And so I think that's why implants have become so much more popular. If you have a missing space and you don't want to touch the tooth in front and you don't want to touch the tooth behind, an implant is a 1-tooth solution for a 1-tooth problem. A bridge is a 3-tooth solution for a 1-tooth problem. When people are deciding how to replace their missing tooth, one of the big choices is it removable or does it stay in? Now, of course, the more convenient option is something that stays in. To have removable teeth is you get an appliance and it pops in and it'll move and shift. It traps food underneath it. It can put a lot of wear and tear on the neighboring teeth. Whereas when a bridge is installed, it's stable. It sits in place. You can't lose it. You can't forget it. It's really one of the lower maintenance options. So if we're given a choice between something removable and a fixed bridge, we'll almost always choose the fixed bridge. You might have heard of something really exotic like a cantilever bridge. What the heck is that? Well, picture a normal bridge. It has a setting or an anchor at one side and a setting or an anchor at the other side, and it spans that gap or it bridges that gap. So it has one anchor and another anchor. The false tooth is in the center. There's some cases where we can't use that. And so we have to have a bridge with one side. Sometimes we joke around it's a bridge to nowhere. It only has one anchor. We can build those in some cases around your teeth, sometimes in the front and sometimes for your smaller teeth, we can use a cantilever bridge. So it's just a really fancy word to describe a 1-anchored bridge. People ask, what's the benefit? Why do I need a bridge? So you don't have a missing tooth, man. If you want a replacement tooth and you decide that a bridge is a way to do it, it replaces your missing tooth. You can smile, you can chew, air doesn't whistle through, food doesn't escape. You have an improved appearance. That's a great reason to get a bridge. If it's in the back, people say, well, I don't care about a back missing tooth. Well, you should. That's where you do all your chewing. If you're missing all that surface area, your teeth will shift, they'll move, your bite can become unbalanced. There's a lot of really great reasons to replace even teeth in the back that you can't see. So if you do need a bridge and you're considering it, have a talk with your dentist. Find out if that's the right thing for you. If a patient asks me, how can a dental bridge help me with gum disease? The answer is kind of can't. It won't walk your dog and it doesn't wash your car either. A bridge is something that it replaces a missing tooth. Now, picture this. If you've lost a tooth due to gum disease and you want it replaced, we might talk about a bridge as an option there, but a bridge still has to anchor on the neighboring teeth. So if you've had teeth that are loose or have become lost or they're compromised by bone loss, you might not want to use those other teeth as anchors, because what if they became loose? What if they became lost? That's an area where you should really be cautious and talk with your dentist about how much bone support you have left and whether that's a good candidate for a bridge or not. Are bridges painful? No, the bridge is straightforward. It's just a piece of precision equipment that we install that replaces a missing tooth. Now, if your question is the process of getting a bridge painful? No more so than a regular dental appointment. Because we use anesthesia, because we use numbing, our goal is to keep you comfortable that whole time. If at any point you're not comfortable, goodness gracious, please tell us. There's things that we can do to solve that. That should never be an issue and should never be a concern during your dental appointment. Share that with us. Let us keep you comfortable. What does a dental bridge placement procedure involve? It involves getting the teeth on either side ready to hold that bridge. A bridge is kind of like three crowns connected together, and it has a front anchor and it has a back anchor. Now, those teeth need to have their shape changed in order to fit the bridge over the surface of it. If we left the teeth their normal size, your bridge would be huge. It would be like giant gumdrops on top of your teeth. That wouldn't fit with your bite. So we do have to do some reshaping, some drilling, and some grinding on those neighboring teeth so that they can be good anchors for your bridge. When the bridge is installed, we use glue for that. It doesn't come in and come out. It stays in place. You can't lose it. You can't forget it. It becomes really like part of you. If you're getting a bridge, you might have a question like, how long is this bridge going to last? Will it be with me a long time? And bridges last almost as long as dental crowns. And it used to be a shorter amount of time, but as the years go by and materials and techniques are improving, time's getting longer and longer. It's not unreasonable to expect your bridge to last 10 or 15 years. That's a nice long duty cycle for a bridge and longer than most people own their cars. Here's the most important part. You need to care for your bridge. If you have something anchored on a front tooth and something anchored on a back tooth, you don't want food, bacteria, debris piling up around those. So kind of like a snowdrift can be up against the side of a house or a fence, you can have food that collects up against the side of your bridge. It is your job to clean around the bridge, but also underneath the bridge. Part of what people don't talk about very much is they make little bristle brushes and they make special kinds of floss for you to clean underneath your bridge and in between those two anchor teeth. That's not optional. That's mandatory. If you want your bridge to last 10 years or 15 years, that's something that you have to be spectacular at. So it comes with maintenance, and that's a big responsibility of having a bridge. If you have a tooth that you know isn't doing so good, if it has chips and cracks, if it's experiencing an infection, if you think, gosh, this tooth might be lost, it might not make it, the time is now to think about, do I want a bridge or do I want an implant? How am I going to replace that tooth? I think the wrong thing to do is wait until the day that it's loose or the day that it breaks. Oh no, how am I going to replace this? You're really not in the best position to make the right decision if it's an emergency. So get ahead of it, stay ahead of it, plan ahead and know what you'd like. Thanks for joining me in sunny Oregon. If you have additional questions about bridges or the alternatives to bridges or what are the drawbacks or what are the good parts, reach out to us anytime. Come in for a consultation or you can call us on the phone, 503-786-3000.